Hello and welcome to our quick guide for Her2 IHC scoring in breast cancer. This is our scoring algorithm. You remember this is a sequential algorithm. First you determine the staining intensity using magnification rule. Then you look at the distribution of membrane staining, whether complete or incomplete, and the third step is to understand whether this affects more or less than 10% of the cells. This algorithm will give you an IHC score, and the IHC score will translate in a diagnostic category like Her2 positive, Her2 low, L2 ultra low, or Her2 null. So we look at the slide and choose the low power, time 4 or time 5, and at low power we can see that there is some staining. Not entirely sure this is membrane staining, it looks a bit hazy. So going back to the algorithm, we are down here. We've now excluded this top portion of the algorithm, which means that the only way in which this case may turn out to be Her2 positive is through in situ hybridization. So we engage the next power in the microscope. This is times 10, and now we start to see lines appearing on the screen. There seems to be incomplete, and not all the cells seems to have membrane staining. We look carefully whether there are areas where there is more abundant staining. So if we go back to the algorithm, we are in this portion of the algorithm. We said is incomplete membrane staining, so you see now the avenue to reflex twitch is gone, and Her2 positive breast cancer diagnosis is no longer tenable in this case. We're going to assess whether there is more or less than 10%, and to do this, if you want, you can use higher power. So you can engage times 20, and here you start to see more cells with membrane staining. None of them seems to have circumferential staining. You can also use time 40 if you want to, just to reassure yourself. But even some of these cells that seems to have almost circumferential membrane staining, there are gaps. So if we go back to our algorithm, confirm that this is incomplete membrane staining in more than 10% of the cells, we are now in this upper portion of this algorithm that says is IHC 1+, which translates to Her2 low. And this is a quick guide to the interpretation algorithm.